Hello and welcome to 72 Dragons. It's a pleasure to have you here, Brendaly Rodriguez. My name is Rahul, and I'm the head of the writing department for 72 Dragons, and we are a production company based in Hong Kong. And we also have Dr. Pietro Pris here today with us, and he is the Chief Operating Officer for 72 Dragons. Dr. Pietro.
Welcome. Just to give a small introduction, Brendaly Rodriguez. She is certified in public health, Fulbright scholar, and a specialist in social health equity impact. Thank you for sharing your knowledge and expertise with our audience today, Brendaly. Brendaly, would you mind sharing with the audience a bit about yourself and how you began your journey in the health field?
Certainly. I thank you for the opportunity. Well, I started with my communication studies as an undergrad, and I specialized in the grad school with intercultural communication and languages. Part that connected me to health was in qualitative research methodologies. It was very much used for healthcare evaluation, needs assessment. With that background and the research methodology background, I went to Melbourne, Australia, and for 3 years, I was really working, putting it to work and use for the benefit of diverse communities in Melbourne. It was quite a variety. One project would have Chinese, Vietnamese, Serbs, Croats, Italians, Greeks, had in common that they were experiencing certain difficulties that were health related. And that's why I was there to be of assistance in capacity building, integrating community researchers into decision-making processes. Yes, and that work as a contractor, it really gave me the experience of seeing and serving as a conduit of working, assisting the U.S. government in this case, in the state, with the provision of better services in healthcare, and integrating the voice of those that could not be normally part of this discussion. So my background in communication was helping me with that.
Great. The second question I have for you is actually related to the first one. It is as a part of your journey, you have done work and research on community health worker as a key stakeholder. So can you describe the role of a community health worker and how they fit in the healthcare system in the US?
Certainly. My first encounter with a promotora, as we call it in Spanish, or community health worker, was a family member, actually, mi tía Carmen, my titi, auntie. She was there being that conduit for our family members and the health system, trying to help us understand like instructions from the doctor, what the treatment meant, helping us educate ourselves better with reading more, listening, asking questions, and being our own advocates in health. I didn't know that there was such a role until I actually professionally started working, as I mentioned earlier, in Australia with these community health researchers, we would call them, but they were community health workers for their own organization, communities. Mm-hmm. And now in the States, we have had that experience a lot, especially with the work done in the border, and also, in the border with Mexico. We have benefited from that tradition that goes way back. They facilitate the access to the healthcare system, improving the service once we put that knowledge to work in the inside, because they have certain qualities and also certain experiences like cultural competency, many times linguistic competency with the populations that they serve. And more, we are trying to integrate them and do a workforce of these. There are several legislations and several institutes and efforts and initiatives within our government, both federal and state, to create a path for the workforce development. And for those that want it, because it's quite a continuum, you have people that are very happy with being a promotor in health, at church on the Sunday after the Sunday service, but we also have the other end of a continuum and a spectrum of experiences in which they do want this as a career.
Thank you for sharing, Brendaly. Definitely, community health workers, promotores de salud, are a key stakeholder in the healthcare system. So thank you for sharing that. Now, in your work, you provide consultative services to various organizations in the intersection between practice and science. Could you elaborate what this is and maybe provide one or two examples for our audience?
Yes, certainly. With the work that I was part of at the Florida Community Health Worker Coalition, it was a labor of love, like about 10 years as part of the creation, the leadership, and establishment as an organization that was representative of the community health workers across the state of Florida. When we say that it was in the intersection between practice and science, we, with the funding from an organization that I'll tell you more in a bit, we were able to bridge that practice and move it towards creating evidence for capacity building and how to make it happen. So we embarked on projects that took and were informed by the daily practice of community service by the community health workers, integrated their viewpoints on what was important to them, what was useful in their everyday work, what could they say to contribute to a research team, an evaluation team, an academic research organization or partner that we have, in this case, what the University of Miami, among others. We also partnered with other in practice, such as federally qualified health centers and free clinics in this state, and also with other research institutions like University of Florida and others, capacity building and training efforts. And in my specialty, it was bringing them into the fold of research, moving them and incorporating them into the creation of new knowledge in the ways that they could then take those results from the research studies and disseminate it back to the community to move the uptake of those results by those that needed to use them.
Well, that's amazing that you were able to do that with your teams, because from practice to bring those to science and to apply that science, it's a challenge. It sounds like great work.
Right. The next question that I had was certainly related to research, but since 2013, you've been an ambassador of the Patient-Centered Outcomes Research Institute, which is also known as PCORI. So can you shed some light on the mission and the works of PCORI?
Yes, we actually call it PCORI in short. And indeed, PCORI is an independent research organization that was created in 2010 and got reauthorized by Congress in 2019 for 10 more years. And at the core, the mission of PCORI is to move the needle, to fund research and research support activities that integrate the voice of the patient, among other stakeholders, into the creation of new knowledge to improve the healthcare systems, and in particular, attention to comparative effectiveness research. We're headquartered in DC, and my story with them began early. In 2013, as you mentioned, I was invited to be a part of a Latina roundtable in which we had representatives from many Latino organizations in different states, and we wanted to be there present. They were really listening, and that struck a chord with me. So I became more interested in the organization after that roundtable and took the training. I learned more about it and decided that, well, let's put this knowledge into action. And I put together a team. And at the University of Miami, we began working and put together several applications. So we were successfully awarded several engagement awards for working with community health workers and creating that capacity training to bring them into the fold. As an awardee, I learned more about the organization, working with them as a funder, and got the invitation to apply to be a part of one of their several advisory panels, with particular attention to patients and the role of engagement. And that's how I became a patient engagement advisory panel member for 3 years. That ended in 2020. And with that, building relationship and knowing more about what they do, what they can do, and what they must do in the future.
It's great that Picari is really studying from hearing the patients' voices and translating into research. That's really a great example to follow for many other organizations in the U.S. and internationally. So connected to that, Brendaly, you have many years of experience of working with community health workers and obviously a vast knowledge on patient-centered outcome research. What is your advice for health workers in the U.S. and internationally who want to make a difference in the health of the communities they serve?
Certainly. Yes, with the work that I saw not only in Australia internationally, but in Ecuador, with working with promotoras and dengue and chikungunya, and also across the United States in projects for the CDC and other clinical trial interventions that I managed at the University of Miami. I always got connected with community health workers. And my humble advice for those that are interested or are already in the field is to have that reassurance that your voice is important, that your experience, your lived experience as a patient, as a member of a community, as a family member, as a caretaker is important. And with that, you may be able to learn more about how to articulate that voice, about how to put it to work for the benefit not only of yours, but also for others. And with that comes more learning, more training, if you're interested, professional development opportunities, and continuous growth to help us in moving the needle, addressing health disparities in the United States and elsewhere.
Fantastic.
Well, this brings us to the end of the interview, and it was, first of all, amazing having you here. And once again, thank you for doing this, and it was a great pleasure talking to you. Dr. Pietro, would you like to add something?
So thank you so much for your example and your leadership. Thank you.
Thank you for giving me the voice.